And let's bring in the Executive Director of HACEY Health Initiative, Rhoda Robinson, for more on this significant day for women. Good to have you join us, Rhoda Robinson, and happy International Women's Day to you.
Happy International Day to you.
Thank you. We're celebrating this Women's Day this year amid the COVID-19 pandemic. When you look at all that we have been through in the past 1 year, what does this show us about the peculiarity of the challenges that women face?
Thank you very much. I think one of the things that we need to recognize, having lived through COVID-19 and survived the different challenges it brought, is that the gains we had in gender equality and resources that we have not been used to the full capacity. What I mean is that we still have a long way to go in ensuring that women, regardless of where they are, their race, their occupation, are treated equally. One of the reports that had earlier been given says that more women during the pandemic were exposed to domestic violence, sexual violence, and a lot of women lost their jobs. For instance, while there are statistics that say that women have about 20% of jobs, more than 50% of the jobs lost during the pandemic were lost by women. And this is something that we need to get back. We need to put more efforts into to ensure that all the gains that we had lost, we get them back this year.
So I spoke to someone earlier, and I like something particularly that she said, and I just want to get your thought on it. She said that we should look at this from a resource point of view. If we are going to develop human resources, a woman is a human resource. So why not also develop, the human resource that is the woman? And I want to get your thought on that.
I think that is one of the key things that we need to also focus on. Majority of the time, we forget that 50% of Nigerians are women. 50% of Nigerians are women. And you cannot make decisions that concern 50% of your population without them being adequately represented. Currently, less than 7% of seats in the House of Rep and Senate are occupied by women. And you cannot effectively make policies and laws that protect that population, that provide for that population, without having their input in the decision-making for things like that. And you need to be able to build the capacity of women to take that position. Another statistic says that less than 30% of women are actually on the boards of major corporations in Nigeria. And you find that this should not be. We need to be able to have women capable enough to take those positions and given the opportunity to actually reach the top in management and the decision levels.
I just want to quickly cut in, because I don't want to miss the point you raised earlier about building the capacity of women, and many are now also suggesting some sort of gender budgeting, that if we're doing our annual budget in the country, we should also bring in women, so specific projects for women, maybe in agriculture, SMEs. Do you think that that's a good way to go in terms of building that capacity for women?
Yes, a good way to go would be recognizing the different needs that women have first. Because you can write a policy, you can design a framework that is not really targeting the needs of women. You find that you say, okay, you've developed a funding that is providing for agriculture in the country. However, you've forgotten that majority of women do not have access to land. Majority of women do not have access to education. Majority of women do not make the decision in their families. So before you can have effective policies and frameworks like that, you need to address the fact that women are not even allowed to take these kinds of opportunity to even move to the next level in the first place. So we need to start thinking in that level as well. So when you're talking about building capacity, you're not just saying building capacity so that women can take seats at government. No, we're talking about building capacity so that they can actively and effectively make use of available resources that is currently on ground in our country today.
A fantastic conversation with you, Executive Director of HACEY Health Initiative, Rhoda Robinson. Thanks for talking to us.
Thank you.